Handwritten notes for the following lectures are given in the description box. These are in the exam point of view. Lines from K.D. Tripathi are simplified and given for you to attend your exams.
Today's topic is routes of drug administration. In this topic, first we're going to learn about the factors governing the choice. What are the factors that governs the choice of administration of drug? Choice of route, okay? Properties of drug. First of all, properties of drug. Physical, chemical properties. Chemical properties, we see pH, irritancy, and the stability and solubility of the drug. Okay, these are the chemical properties we see in a drug. And what are the physical properties? It's whether solid, liquid, or gas. Okay. Then what are the other thing? First, we should see the site of action. Where is that site is targeted? Whether it is approachable or it is not easily approachable. And then what we should see? Then we should see the absorption, at what rate and what extent the drug is absorbed. These are the factors we should see next. Next, what is the factor? Next, desired rate of the onset of action. That is, at what rate the drug starts to act is known as onset of action. Okay, it differs from the extent of absorption and action. Effect of the drug by the digestive juice and first pass metabolism. I will explain these later. Please wait. And accuracy of the dosage we require. What are the accuracy of some the drugs need to be accurately and precisely given, or else it may end up in different complications. Okay. Then types of routes. What are the types of routes? First, local route and systemic route. First, I'll say difference between the local and systemic route so that you won't confuse with each other. Okay. Local route means site of application of the drug and site of action of the drug is same. Okay, where we apply the same action, the action is performed. As vice versa in systemic route, site of application, site of action is different in the systemic route. Okay. Next, first we are going to learn about the local routes. In local routes, what we are going to see, topical routes. Topical routes come under local routes because site of action and site of application is same. Topical means only external application. It should be directly applied on the site. No other injection, no other any other form of giving the drugs. It is only applied directly on the site. Okay. Efficiency. It is very effectively delivered. Okay, very effective method of delivering a routes because it is directly applied. And for GAT, that is, a site of action is GAT. The target organ is GAT. We should give non-absorbable drug. Why non-absorbable drug? Because absorbable drug get easily absorbed into systemic circulation, but non-absorbable drug acts on, but the target is GAT. So non-absorbable drug is given. Example, sulfacrate and vancomycin. Okay. Then on bronchi. On bronchi, inhalation method is. Why inhalation method? Application, site of application is bronchi and site of action should be performed. The target organ is also bronchi. So it is a come under topical routes. So example is salbutamol and fluticasone. Okay. Deeper tissues. Deeper tissues means some deeper tissue, the target organ is in the deeper side. Okay. That is known as the deeper tissue. To approach these kind of tissues, we use syringe type applications. Main condition is that side should be in the side systemic absorption should be slow. That means blood flow should be slow. If the blood flow is increased, the systemic absorption will be increased, so that drug will not stay there in the site for a long time. Do you understand why the systemic absorption should be low? Example, intra-articular injections. Intra-articular injections are given in the knees and retrobulbar areas. Retrobulbar areas means behind the eyes. These all points are discussed in given in KDT so that you won't miss any points. Arterial supply. Arterial supply, there's much point is not given in the textbook. Just remember arterial supply for cancer, anti-cancer drugs are infused in the brachial and femoral arteries. These are the examples of arterial supply. There's not much point is not given in your book, the KDT. We don't need to, it's beyond our level. Okay, no need to discuss much. Then we come to a systemic routes. What is the intention of systemic routes? What is the intention we give the drug? That intention is a drug should be given, should be absorbed in the blood, should be absorbed in the veins or vessels, blood vessels, and then it should flow through the blood vessels and supply to the site of action. That is the intention. Okay. First, oral route. What are the advantages of oral route? Oral route is safe and very convenient to use. Yes, safer and convenient to use. Okay. And very painless. It's a painless method, painless routes. And no need any sterilization. Very important is slower reaction. Its action is very slow. So for emergency condition, we can't use. Children and unconscious and uncooperative patient, a patient is mentally ill, they are not in the condition to take the tablet on their own. They can't use the oral route. Palatable means it's unpleasant taste. Okay. And some of the oral drugs may cause nausea and vomiting. And some drugs, absorption is very unpredictable and easily destroyed by digestive juice, because all oral drugs are taken into the stomach and it is easily destroyed by the digestive juice. Pre-systemic metabolism is before reaching the target site, the drug get metabolized. Example, GTN. Now this listen to this story. The drug that enters that get absorbs into the small intestine. After getting absorption during by the enterohepatic circulation, it gets into the liver, and when it gets into the liver, there is an enzyme. What are the enzymes present in the liver that metabolizes the drugs? But when it gets metabolized in the liver, the site of action is heart for the GTN. But before reaching the heart, it get metabolized. That is pre-systemic. System is heart. Before reaching the heart, it is metabolized. So it is known as pre-systemic metabolism. Okay, that's how the drug gets inactive and it does not perform its specified action. Understood? Then food drug and drug interaction. Many food should be avoided and drug should be avoided before before taking a certain drug in the oral route. Okay, next, sublingual or buccal. What is sublingual or buccal? Sublingual or buccal routes. Okay, what are the conditions for sublingual? It should be lipid soluble and non-irritable, because we are taking through the buccal route, okay, through the mouth. So it should be non-irritable to avoid infections and some rashes. Okay, advantages: action is rapid. Why the action is rapid? Because all sublingual vessels they absorb the drug very fast, and dosage control of this is extraordinary, because after expected action is done, we can split the tablet or the drug, okay, outside. Do you understand why the dosage control is extraordinary? The liver bypass is done. You already know it's not passing through the intestine. Anything in the drug not passing through the intestine never gets into the portal circulation, so it is not bypass. It is not metabolized by the liver, so it is easily absorbed. Okay, you understood? And GTN and are the examples of the sublingual routes. Okay, understood why the drug is bypassed? Because drug is not absorbed through the intestine, so it is never passes through the portal vein. Okay, next, rectal route. Type and irritable. Type means it can be irritable, and unpleasant drugs are for unpleasant drugs we choose rectal routes. Why? Rectal there will be less sensitivity, so that we can easily use these routes. Okay, and what are the forms? Retention enema or suppositories. Suppositories is like a tablet that we use in the mouth, and the suppositories are the other method that we use in the rectal route. Understand? And liver bypass. Liver bypass is only 50%. Okay, because 50% of the drug enters into the internal hemorrhoidal vein, and 50% of the drug enters into the external hemorrhoidal vein. The drug that enters into the internal hemorrhoidal vein does not bypass, and the drug that enters into the external hemorrhoidal vein bypasses, because internal hemorrhoidal vein is a part of the portocaval anastomosis. You have learned the portocaval anastomosis in the first year anatomy, and you would have remembered that there's anastomosis between the veins that present in the rectum. So happens. Okay, example, diencephalon and indomethane and paracetamol. Okay, these drugs can be given through the rectal routes. And cutaneous. What is cutaneous? Cutaneous is something given through the skin. Okay, it should be lipid soluble. Why always we say lipid soluble or for very faster absorbable? Because all the cell membrane is made up of phospholipids. Okay, so lipids are easily acceptable to crosses the cell membrane. It can be easily crosses the cell membrane, so it is very fast, very rapidly absorbed. Okay, bypass the liver? Yes, obviously it bypasses the liver, because why? Because it never passes through the portal vein, never absorbed into the small intestine. Okay, TTS is transdermal subcutaneous patches. Okay, what are the transdermal? It is in the form of adhesive patches we stuck in the skin. Okay, now I'll explain how it works. There will be a occlusive membrane above that, and there will be a microfine pores. Okay, these pores controls the rate of release of drug. Okay, understood? These pores controls the rate of release of drugs. You understood that? The drugs are blue color marked as a drug, and green color marked as micropores, and red color is subcutaneous vessels. And the drug rate, and the important thing is it prevents toxicity. How does it prevent toxicity? The rate of drug to the skin is less than the rate of absorption from the skin. So that toxicity is easily prevented. You just think on yourself, why toxicity is prevented? Rate of absorption from the skin is less than the rate of drug absorption from the skin. Delivering to the skin is less than the rate of absorption that is absorbed from the skin. Okay, so only need an amount is delivered before it gets into a toxic level. Okay, common site of these patches can be used on chest, buttock, and arms are the common site. We can use all these patches. Okay, do you understand? Then Senatile is another form of drug that can be used in the patches. Okay, here we can main thing the site of application is on the derm, and serotonin is a opioid. Okay, it acts on the CNS receptors. So site of application is derm, that is skin, and site of target organ is CNS. So it is a systemic application. You can understand why it doesn't come under the topical routes. Okay, you can understand, right? Okay, disadvantage. What are the disadvantage we are going to see? Some local irritability. Here disadvantage is very less. Okay, local irritability and some erythema can be seen. And now we come under the inhalation. In inhalation, what type of drug can be used? Very volatile and gaseous or liquid drugs can be used, because it is inhaled. There we can't use a very strong or very thick liquids. Okay, you understand? A very common example is anesthetics. We all know it is given through the inhalation. Okay, alveoli to blood flow to CNS. You understood why it come under the systemic route, not under the bronchi that come under the topical route, because it site of application and site of action is different, and it can be easily, this drug administration can be easily removed. How can we remove? After removing the drug administration, to the expiration, the drug is easily eliminated. So the person require on her or on themselves. Okay, they can easily recover from the drug on their own. There need to be no assistance to take out the drug. Okay, then nasal route. Advantages: digestive juice, and in every other route, digestive route and liver is bypassed. It's mandatory. Okay, it should be bypassed, except in the oral route. Every other route, the digestive juice, liver is bypassed. What is the difference between the nasal and the inhalation? Nasal means the site of application is the mucosa of the nose. Okay, mucosa of the nose. There the site of application is alveolar. Then parenteral. Parenteral means any other route other than the GIT is known as parenteral. Okay, any other route that an injection like method that directly gets diffused into the tissue fluid or the blood, and no need to cross of any membrane. There is no need. Okay, it directly infused into the blood, so there is no need to cross any membrane. So all the limitations of oral route is now overcome. Okay, go on. If you have any doubt, go on visit the limitations of oral routes so that you can understand how all the oral routes limitations are overcome. Important is parenteral refers to what are the important parenteral routes? Okay, the subcutaneous. So first of all, subcutaneous. Subcutaneous is site of application is loose subcutaneous tissues. Okay, site of application, that is loose subcutaneous. Here the nerve supply is high and the drug supply, not drug supply, the blood vessel supply is less, so that the absorption of drug is so that what toxicity is prevented. If there are more absorption, there will be systemic. If the systemic absorption is more, the drug will be morely absorbed. So here the toxicity is prevented. So what is, so here the blood supply is less, so that we only use the lipid soluble drugs. Okay, not the water soluble drugs. Self injection is possible because subcutaneous, the depth is not more. Okay, depth is only very less inches, so it is self administrable. In shock patient, this cannot be used. Why in shock patient? You think about that. In shock patient, as a compensatory mechanism, the subcutaneous vessels get constricted, so you can't use that subcutaneous method. Okay, you understood? In a shock patient, you can't use. Next, intramuscular method. It's another method of the parenteral route. Okay, application sites are the major muscles, that is deltoid, triceps, and glutes. And then what? Glutes, pectoralis major can be also included. Okay, understood? Muscles. In muscles, compare this and last example. Nerve supply is less and vascular supply is more. So here vascular supply is more. Understood? Vascular supply is more, rate of absorption is more, so water soluble drugs can be used. Water soluble drugs are normally less absorbed. As the rate of absorption is more in the intramuscular area, that is rate of absorption is very more, so that usually water soluble drugs are absorbed very less. So okay, so here we can use water soluble drugs. Now we get into the IV. IV. It can be given as a bolus or no. Bolus means a complete dose is given at a time. Okay, this one is bolus. Then intima layer of the veins are less sensitive. Okay, so irritable drugs can be used here. Kind of irritable drugs can be used. If sensitivity is less, irritable drugs can be used. Same in the rectal route also. Sensitivity is less, so irritable drugs can be administered. That's all. Don't study the points instead. Okay, just correlates. Okay, what are the risks? Risk are the thrombophlebitis. What is thrombophlebitis? Thrombophlebitis is a blood vessel clot. A clot occurs in the blood vessels is known as thrombophlebitis. Okay, in IV injection, consider this is IV injection and blood vessel get ruptured, and due to the rupture, the blood starts to perform the hemostasis. So hemostasis may clot the blood. Okay, this may causes the adjacent tissue necrosis. Why adjacent tissue necrosis? The blood vessel is blocked, so the blood supply for the adjacent tissue is also not very poor. Due to that, the tissue death, necrosis means tissue death. The tissue death occurs. Extravasitation. Extravasitation means these are all points are discussed in the KDT. After listening to this lecture, go read your book or read the notes that description is that is pinned in the description. Please, it will be so helpful for you to understand this concept. Extravasitation means the drug comes outside the vessels. Why do the drug come and say? Because the concentration of the drug inside the blood vessel is very high, and the tissue fluid, the concentration of blood is very less, and the blood drugs comes outside and it gets accumulating between the tissues. It also causes adjacent tissue necrosis. You understood why? What is extravasitation? Extravasitation is the leakage of fluid outside the drug. And the advantages in the IV is bioavailability is 100%. It's by 100%. Okay, in no other route the bioavailability is 100%. And hair embolism there's a chance of occurrence of hair embolism. Okay, what is bioavailability? A fraction of the drug that we administered. Suppose we are administering 100% drug and it enters into the systemic circulation in active form. Only 70% will enter, okay, in all other routes, okay, because of some that may not get absorbed. You understood why? See, in this topic, 100% is administered and get absorbed in oral route. It gets absorbed to the intestine, and 100% enters to the liver, and 50% of get metabolized. Only 50% comes out in the active form. So the bioavailability is only 50%. You understood what is bioavailability? The active form of drug, that is only active form of drug that reaches the systemic circulation, that reaches the target organ is known as bioavailability. Another advantage is quick response. Response is very quick. Okay, we can understand whether we should reduce or increase the dose. Example, BP. See, when we give the IV injection, the blood volume is increased. Blood volume increases. What happens? Venous return increases. Okay, when venous return increases, what happens? As a compensatory mechanism, the BP gets altered. Okay, understood? You know that we have learned all this in the first year physiology. BP gets altered. So this is how a quick response can be. So the response can be monitored immediately in IV. Okay, you understood? Okay, dosage can be maintained here. The main advantage is dosage can be accurately given, very accurate. No other route can be given in such accuracy. Okay, so very important drugs that need to be given in this, that has a small therapeutic window. We learn all these terms later. Now understand, very dosage can be maintained very easily. Okay, to decrease the risk, we should inject the drug in the running IV, not in the stagnant IV. Okay. Okay, with this I'm ending up this session, and go read the book or the notes given below in the description. It will be very, very useful. Sorry students, it will be very, very useful. So don't miss that. Immediately after listening to this lecture, go read your textbook. It will be very easy for you to understand, because you all know KDT is very tough to read and understanding the concept and the points. Now I have explained all points with easy examples, and I have the concepts are easily explained. Okay, now go read your